Hello friends, let us learn about a new topic today, that is primary sclerosing cholangitis. So this primary sclerosing cholangitis, the cause is unknown. Primary, it is due to some disease in the gallbladder, and sclerosing is sclerosis, that is the whole lumen of the bile duct is filled with fibrosis, and cholangitis. Cholangitis is, as we know, inflammation of the bile duct. So here the main cause of it is unknown, and here there is diffuse inflammation of entire biliary tree, and this entire biliary tree inflammation later leads to fibrosis of the biliary tree. So once there is fibrosis, there is obliteration of lumen of both intrahepatic and extrahepatic biliary tree. Extrahepatic biliary tree. Whenever there is obliteration of lumen of intra and extrahepatic biliary tree, this causes biliary cirrhosis and then portal hypertension and liver failure. Okay, because the whole lumen which is there, if this is the bile duct, the whole lumen of the bile duct has been obliterated, and this is the gallbladder. This is the hepatic duct, right and left hepatic duct, and common hepatic duct and common bile duct. The whole lumen and also the intrahepatic biliary tree, even that lumen is obliterated, leading to biliary cirrhosis, portal hypertension and liver failure. So, what is the cause of primary sclerosing cholangitis? It is unknown, but it can be due to bacterial or viral or toxins or immunological or genetic predisposition. Okay, this is seen. So any of these causes can lead to the diffuse inflammation of entire biliary tree, leading to fibrosis, obliteration of lumen, and thus causing biliary cirrhosis. So what do you see pathologically? Pathologically, if you see the this primary sclerosing cholangitis, it shows bile duct proliferation will be seen, plus it also shows ductopenia and fibrous cholangitis. And this may slowly progress to biliary cirrhosis, which is end stage. Okay. Now, what are the clinical features? The major clinical features of primary sclerosing cholangitis is, here there is cholestasis, that is bile accumulation. Because of the fibrosis of the biliary duct, there is bile accumulation, that is cholestasis. This will cause fatigue, and there is deposition of all the bile salts, so it causes pruritus, and then this is often debilitating, very difficult to control, and then there can be steatorrhea, and because bile pathway has been lost, there is deficiency of fat soluble vitamins, and also there can be even metabolic bone disease. Okay. Then laboratory findings. In laboratory findings, the primary sclerosing cholangitis. Here there is elevated liver function tests. So let us see this. What are elevated in liver function tests? So diagnosis in liver function tests. Alanine, alkaline phosphatase levels are increased in 2 folds, whereas albumin levels are decreased because of liver failure, and prothrombin time is also prolonged. In some, even aminotransferases, that is AST and ALT, also will increase, and on biopsy, if you see, in some they will have the features of autoimmune hepatitis. So primary sclerosing cholangitis plus autoimmune hepatitis, even this form an overlap syndrome. So in this overlap syndrome, autoantibodies are positive, but only PSC autoantibodies are typically negative. But in 50%, in 65% of people with primary sclerosing cholangitis, perinuclear anti-neutrophilic cytoplasmic antibody is positive, which is P-ANCA is positive in 65% of the patients, and in around 50% of the patients they have associated with ulcerative colitis. So in all patients with primary sclerosing cholangitis, colonoscopy should be done to exclude ulcerative colitis. Okay, now diagnosis. The best diagnosis is by cholangiographic imaging. The biopsy is not diagnostic. So always we have to do cholangiographic imaging. In that we do MRI with magnetic resonance pancreatography. So this will show multifocal stricturing and beading of both extra and extrahepatic biliary tree. Okay, these strictures are short with intervening normal structures. So there is stricture formation, and then there is normal part again. There is stricture, there is normal, there is stricture, there is normal. This is how the beading is seen. So there is stricture and there is a normal part intervening the stricture. So this is what is seen in MRI with magnetic resonance cholangiopancreaticography. Okay, if the patient has high grade of strictures, high grade diffuse strictures are seen, then this has poor prognosis. Okay, now what is the treatment of this primary sclerosing cholangitis? The major treatment is by UDCA, ursodeoxycholic acid can be used, and you can also do endoscopic dilatation of dominant strictures. the best treatment which is available is liver transplantation. Okay. And then, but the complication of primary sclerosing cholangitis is development of cholangiocarcinoma. So this development of cholangiocarcinoma, once it has been developed, so this is a contraindication for liver transplantation. This is the normal treatment that you can use. Then management of complications, how to treat the complications. For complications, if you have the cholangitis, acute attack, if there is acute attack of cholangitis, then always use broad spectrum antibiotics. Okay. And then if there is obstruction to extrahepatic bile duct, that is dominant stricture, in such cases you will have to place a plastic stent or balloon dilatation can be done. Okay. And then if there is any fat soluble vitamin deficiency, so in such situation you will have to replace them. The vitamins should be done. Then metabolic bone disease should also be treated by. For metabolic bone disease, do a bone density scan. And then you will have to supplement with bisphosphonates. Surgical treatment. Orthotropic liver transplantation, as I have said just now. Okay, so these are the different transplants which are seen. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.